Hi, I wanted to send you a quick video just saying hi and thank you. Um, Wrapping up for the year 2020, I realized we've all been on a bit of a roller coaster. So first of all, I want to thank you for staying on board and hanging in with us through all of the ups and downs. I also want to let you know that going forward for 2021, I am still holding pretty tight to the regimen that we created during the beginning of the pandemic. So by that, I mean that my efforts have been towards keeping the birth center very safe, very clean, always ready for the moms and families birthing at the center, birthing on site. So since the pandemic restrictions came into play since March of 2020, we implemented some very strict protocols, including only opening the space 1 day a week for on-site visits, thereby keeping the space pretty well shut down and clean and ready to go so that birthing mothers and families could come in at 24 hours a day without any concern about the chances of infection. So we've been doing well with that model. Throughout the year, we've had a good many babies, and every last one of them, we had no problem. Families have been able to come in and participate with their birth. We have had a restriction on siblings and young children, but we have had partners, mothers-in-law, doulas. So up to 3 adults are able to come. During labor, of course, we don't anticipate that you need to wear a mask or your close supporters, but our staff will continue to use PPE for our own protection and also to keep our environment safe. So we will continue with this regimen at this point. If you have a specific ask or a particular need for something different, just please approach us and let me know as soon as you can so we can work it through and see what's possible. As far as clinic goes, like I said, we are only going to open 1 day a week. And during that time, we will see patients who need on-site visits. So at least once per trimester, you'll get your on-site visit. You'll also get visits weekly after 36 weeks coming up to your labor. And then also you have access to have an on-site visit the minute you have any particular concern. During the rest of those visits will be, they'll be done by telehealth, and we are asking you to find some supplies to help with the telehealth visits. And also we are providing supplies for the telehealth visits. During your telehealth visit, for example, we want you to listen to your baby's heartbeat with the Doppler, the baby's heartbeat machine that records the sound and we can hear it. We want you to have a blood pressure cuff at home so you can check your blood pressure and report that in. And we will be sending you urinalysis strips, the urine pee sticks that when you pass urine, you can test to see what colors change and to know if there's any signs of infection, any glucose, anything untoward that we need to take care of. So the things that you would do in the office, you can actually do at home with the support of your midwife and your assistants, your medical assistance staff. Okay, so we aren't asking you to do telehealth visits in a vacuum, but rather with these supports. Now we understand too that it's not always comfortable and not everybody wants to do telehealth during their pregnancy. I fully understand that. But again, in order to maintain the safety and the standards of the environment in the birthing center building, we are going to continue with only having access 1 day a week for clinic services where those that need an on-site visit would come in, have their visit and leave. So I want to again thank you for your patience. I want to encourage you to stay safe, do all of the recommendations. I've also included a link for you about the vaccination. We do not have access to the vaccination, nor will we be in a position to administer the vaccination, nor are we recommending necessarily. We're just letting you know that we want you to stay up to date with the latest information that is being put out as far as what we all should be doing, but particularly you as a pregnant person should be doing in regards to COVID-19. So that's everything I think I have to say today. Make sure that you are in touch with us on anything. Don't sit home worrying. We don't want anybody scared. Please use text because that's always easier for communication. Use email. You may try the phones. Of course, they're pretty busy, but you know that if you don't get an answer, that means we haven't gotten to your message yet. And please be patient, or if it's urgent, go straight to the emergency line. The emergency phone number is on the back of your passport card, and it's also in the email. And that's the 321-228-7536. That is the 24-hour emergency line. Share it with your family members. Everybody who needs to know that number should know it. Okay, so with that, I will stop talking. We will see you in the clinic very soon. We will see you in labor as it's time. And again, all of these efforts are to make sure that we keep a safe birthing center environment for you, your baby, and your family. Take care.